excited for our next speaker as well. Dr. Nicole Alexander-Scott is someone who I have a deep respect for in the state. It's always exciting when you get to introduce someone you have like an intellectual crush on. That's nice. And actually last year I'm excited to hear more about the 90-90-90 campaign, because last year that was signed at this event, and I'm now going to reveal what a nerd I am to all of you. It was signed with a Planned Parenthood pen that I kept at my house, because I was like, it signed a really important bill, that's kind of cool. So I also am excited to see you back this year, and excited to hear how things are going.
Good morning. It's such an honor to be here today with you on World AIDS Day. Such a monumental event that really captures years and years of work, of passion, of heart, and things that are important to all of us and to our families. I'm so pleased to be able to share some updates about the HIV work that has been happening throughout Rhode Island in the last year, and to share updates about our collaborations with all the dedicated HIV champions throughout the state, both represented here in this room and those that we know. But before I start, I want to recognize both First Gentleman Andy Moffitt as well as Governor Raimondo. What you heard from the First Gentleman is more evidence of what I've witnessed since day one of being a part of this administration. Governor Raimondo has made the health, safety, and security of every single Rhode Islander her absolute priority. And that's something that's an honor for me to be able to get behind and advocate for. As the First Gentleman noted in passing, there is some uncertainty about what last month's election results will mean for our communities. There's fears, there are other elements that have resulted from that. But one thing that you can be 100% certain about is that Governor Raimondo, the team she's put together, and all of those who are on her behalf will fight every single day to make sure that Rhode Island is a place that embraces and defends tolerance, diversity, inclusion, compassion, and love. And there are so many people here who share this vision and this commitment. We're fortunate to have some of them with us in the room today. I'm grateful to be able to acknowledge Representative Diaz, who's here with us and has really been an advocate for the communities that we are talking about. Thank you. Also, Providence Mayor Jorge Alorza will be joining us at some point and has been an important partner. You'll hear soon from Paul Alberti, who's representing the Executive Office of Health and Human Services, which is a key partner in helping to address the treatment and treatment as prevention element of HIV, AIDS, and STIs. Also, Jacqueline DeMera is here, who's been an advocate and an important representative of our community. Ray Joseph, also from AIDS Care Ocean State, is represented here and in the room with us today. We also have Steve Horahan here from APRI, AIDS Project Rhode Island, and we have so many other community advocates. Project Renew, who's here, Project Weber has done amazing work, and everyone that you're pointing to within the room right now. We also have Colleen Daly Endoy from Project Weber and Renew, and all the members of the Rhode Island HIV and STI Prevention Coalition. So thank you all, not just for your work on this issue, but for your leadership and everything that you do from the heart to build a healthy, safe state for all Rhode Islanders. So to get to what Kira was referring to, it's hard to believe, as you said, but a year ago, Mayor Alorza and I were here with Governor Raimondo to sign Rhode Island and Providence as the first city-state partnership to join the international 90-90-90 campaign. The three goals of the campaign are ambitious and aggressive, but I have every confidence that they can be met by Providence, Rhode Island, and everyone here who's committed to it. The first goal is that by 2020, 90% of all HIV-infected Rhode Islanders will know their HIV status. And we're doing well there because we're currently at 88.8%, so just about 89% with that. The two subsequent goals include by 2020, 90% of all HIV-infected Rhode Islanders will be in care and receiving treatment. At that level, at the state level, we're at just almost 60% of Rhode Islanders who are HIV infected and are in care. So there's tremendous work that needs to be done there in partnership with our providers as well as with others. That connects with our third goal of the 90-90-90. By 2020, 90% of all HIV-infected Rhode Islanders will have suppressed viral loads. We're currently at just under 56% there as well. So we have a lot more work ahead of us over the next 3 years. But in the last year, we have laid some very sound groundwork. Not too long after signing the documents last year to sign on to the international campaign, we established the 90-90-90 steering committee to provide guidance and direction for what we need to do as a state to achieve these goals. The committee is comprised of community partners, including those who are connected to the Prevention Coalition, as well as healthcare providers and other members of healthcare organizations, and individuals who are affected by HIV. That group together is forging what resources exist to see how we can leverage that and really tackle, in particular, those second two 90s, which I'll get into. In addition to that, we continue to fund community agencies who provide free and anonymous rapid HIV testing, and we continue to support Encore, the state's needle exchange program, which we know is critical and directly ties into the other important initiatives that Governor Raimondo has prioritized, which includes our overdose epidemic that we're tackling full force as well. If someone with HIV stops taking medications to suppress their viral loads, we have multiple components in place to get people back in care, one of which includes the Rhode Island Department of Health's Return to Care program that reaches out and helps the individual address the barriers that prevent them from staying in care. And that's really what the heart of the energy needs to be focused on. And in addition to that, the Executive Office of Health and Human Services is also focusing efforts on keeping patients in care and taking their medication so that their viral load can stay suppressed and they can live the healthy life they deserve. And Paul will talk about that a little bit more shortly. So those are just a few of the examples that are underway, but we wanted to really take this opportunity to express how committed we are to this and to invite anyone to join this effort as we push forward. We work closely also with the HIV care and prevention planning group that really is tying in our 90-90-90 steering committee work. So as we look to the new year and plan our next steps, we're benefiting greatly from the data that exists in the state because we want this to be strategic and evidence-based. Part of that I'll share with you is data that's come from Marion Hospital's immunology clinic, which cares for more than 2/3 of Rhode Islanders living with HIV and AIDS. It gives me an opportunity to give kudos to Dr. Adia Rana, who's a dear colleague who's here, who has led a review of their patients' records, which has determined that unstable housing, mental health, and substance abuse are the 3 biggest challenges when it comes to engagement in care. That's a critical data point as we look at how we're going to address those second two 90s that have the most work that we need to improve and advance in the next few years. Dr. Rana's insights remind us that there are many social and environmental factors that underlie HIV in Rhode Island, as well as many of the other diseases that we often talk about. And as the first gentleman has noted and is well aware of, these factors still unfortunately include stigma and discrimination that needs to be tackled face on. These factors are part of why we continue to see the rates of new HIV diagnoses among men who have sex with men being 90 times higher than the rate for heterosexual men and women. That also includes our transgender community that is critical for us to advocate for and be responsive to. These health disparity numbers of this magnitude are absolutely unacceptable. I often say, we often believe a person's health outcomes should not be determined by the zip code that they live in. You shouldn't live in a certain zip code and have it understood that because of the lack of resources in that zip code, you're not going to live as long as you should be living. With this, we're adding to that, your health outcomes should not be determined not only by your zip code, it should also not be determined by your sexual orientation, by your gender identity, or by your HIV status. It should be regardless of those, in addition to those assets or ways of life, you should have access to living the longest, healthiest life you can live in the strongest community that you have and that you're in. There is so much dedication and perseverance in the HIV community in Rhode Island that I'm convinced we're going to be able to make these statements a reality. That's why I know we can turn these numbers around. I know that working together, we can prevent HIV transmission and help every man, woman, child, and trans individual who is living with HIV and AIDS live a long, full, healthy life the way we all deserve. So thank you again for all of the incredible work that you do. There's so much more that we have to do, but we're committed from the governor on through to every one of you here to making it happen. Thank you.
Thank you, Dr. Alexander-Scott. It is exciting to hear how much work the state has been doing and to get an update on how, with our very ambitious goals, we are doing.